Sickle cell trait. Hi, I'm Dr. Nina, sickle cell expert and holistic medicine practitioner. I want to thank you for visiting us at TOVA Community Health, primary specialty care for the whole family. To learn more about TOVA Community Health, please visit our website at www.tovacommunityhealth.org. You can also give us a call at 302-429-5870, extension 120. Also, like us on Facebook and Instagram at TOVA Community Health. We are your neighborhood medical home. What is sickle cell? Sickle cell is an inherited blood cell condition that affects the hemoglobin. Hemoglobin is a protein in the blood cells that carry oxygen through the body. The blood cells form into a shape of a half-crescent moon, like a C, which makes it difficult for the blood to pass through. What do sickle cells look like? Cells with sickle cell hemoglobin are stiff and sticky. When they lose oxygen, they form into the shape of a sickle or a crescent moon, like the letter C. These cells stick together and can't easily move through the blood vessels. This can block circulation in the blood vessels and the movement of healthy, normal oxygen-carrying blood cells. What is sickle cell trait? Individuals with sickle cell trait inherit one sickle gene from one parent and a non-sickle cell gene from the other parent. The sickle cell gene can be passed along to their children. People with sickle cell trait most often do not have any symptoms of sickle cell disease.
Hi, I'm Dr. Nina Anderson. I'm the Executive Director of TOVA Community Health.
I found out that little Jimmy had the sickle cell trait at about age, he was about maybe a month old actually. The doctor called us back in to have the test done. So we were advised that they were going to do the test. So we brought him into the center and they did the little footprint. It took me about 15 minutes. And I don't know if we got the results that day or we were called back later, but we got the results basically stating that he had the sickle cell trait. Now that I know my son has the trait, it's important to me because it's important to educate him. So I've told him, explained to him how important it is to, when he meets people, if he's interested in dating at a later age and he wants to get married, that it's important to find out their status. We talk about what's the age status, what's your status, and he needs to know what's their sickle cell trait status. Because I think it's important for them to know if they decide to have children. That's a discussion that needs to be had because it's possible that they may produce a child with the full-blown disease. It's really important to communicate with their teachers and their coaches if they're active in sports. To let them know, to look for signs, if they don't know if the child has sickle cell trait, for a child who may be going to the bathroom a lot, or if they are complaining about having pains in their backs or their back or their legs, that's important. At times, I know coaches could be very hard on the players to push, but look for those signs. If a child says they need a break, please allow them that break because a child with sickle cell trait could possibly collapse on the ground and possibly die. So it's important that, the families communicate and be transparent to share this information. There's nothing to be ashamed about. And also educate your children, if you have a child with the trait, to share that information with their spouse or the person that they're dating before they have children. If they're educated on this, these are all different things that we can do to break the sickle cycle.
How do you inherit sickle cell? Sickle cell is an inherited condition caused by a defect or a mutation in the gene. A person can be born with sickle cell disease if two trait genes are inherited, one from the mother and one from the father. A person who inherits just one gene is healthy and said to be a trait carrier. A carrier has an increased chance of having a child with sickle cell disease if he or she has a child with another carrier. For parents who are each carriers of a trait gene, there is a 1 in 4 or a 25% chance with each pregnancy of having a child with sickle cell disease, just like rolling the dice. Inheriting sickle cell trait. If one parent carries the sickle cell trait and the other parent does not, there is a 2 in 4 chance with each pregnancy of having a child that is a sickle cell trait carrier, and a 2 in 4 chance the child would not have any traits. But if two parents carry the sickle cell trait, there is a 1 in 4 chance of having a child born with sickle cell disease, and each pregnancy carries the same risk. A 2 in 4 chance the baby would just have the trait, and a 1 in 4 chance the baby would have no traits or normal hemoglobin. Why is it important to know your sickle cell trait status? Sickle cell disease and sickle cell trait can be passed down to your children through your parents' genes. Some people carry the sickle cell trait and they do not even know it. Educate yourself and others who carry the sickle cell trait. It can help you make better health decisions.
My name is Beth and I have sickle cell.
You have the sickle cell trait.
That's what I meant. I have the sickle cell trait.
I'm her mom, Diane McCluskey, and I have the sickle cell trait. Right after Beth was born, September 24th, 1993, I brought this wonderful child into the world. And it must have been a couple weeks later, and I got a piece of paper in the mail, and I opened it up, and then it, it informed me that, the blood test had come back, that my daughter had, tested positive for the sickle cell trait. And my first reaction was like, this can't be right because I'm Caucasian, And so I called the number, and I, explained to the person on the other line. I said, this can't be right. I said, I am Caucasian. And she said, this is her exact words, "Oh, honey, it must be a mistake. Just bring her back in and we'll retest her." And so we went back in, we retested, it was positive again. And she's like, you need to go to your pediatrician. So I took her to the pediatrician, and he's like, this can't be right, you know. So he tested her again, third time, and positive. And he's like, that's it, I'm testing you, I'm testing your son, Brian. And so they came back positive. And he's like, this is the first time in 35 years of practice that I have had a Caucasian family with sickle cell trait.
Daughter.
Yes.
When did you find out that you had the sickle cell trait? Was this story told to you?
Basically, that's kind of how it was told. It was probably from my brother. He's always been very adventurous, wanting to skydive, scuba dive, whatever. And I showed the same interest, and that's kind of how I found out, was by saying, you know, I want to swim with the dolphins, and I want to swim with the fish, and hey, you can't because you have sickle cell trait. So that was kind of, I didn't really know what it was, but I kind of found out from her through that there's limitations because I did have the trait.
At first he didn't. I actually started doing a lot of my research on my own, and you know, I found my mom is Italian, and her family comes from Sicily, and so I had read someplace that it was, you know, it was rooted in Sicily, that it could be rooted in Sicily. So and then I guess he did a little bit of research and confirmed that, you know, my findings also.
It's almost like a background check. You have to figure out, you know, whether or not they have it, because it can be passed on. So there's extra worry. I know, obviously, she passed it on. So now it's me next. So now I have to make sure that I'm more careful with finding, you know, in a significant other, whether or not they have it or whether or not, because it can be passed on to children with the trait. I mean, it's always just kind of like a joke. I never really, they kind of laugh it off like, oh, okay. And then I have to explain that I actually do have it and that it's kind of an actual, you know, worry for me. Most of them don't really know what it is when I ask about it. So I kind of have to explain background, and most of them don't know.
I mean, at first when I found out, I actually cried. I thought I had given my daughter this terrible, you know, disease, my son this terrible disease.
Absolutely.
And you know, and here to find out it was just the trait, which, you know, but still it was devastating when I found out.
Oh, I didn't know that. Did you know?
No, I did not know
Okay,
that.
well, now I know.
How to get screened for sickle cell trait. Contact your primary care provider or a local health clinic. Couples who plan on having children should meet with a genetic counselor. Contact TOVA Community Health to schedule a sickle cell trait screening and/or a consultation. You can also contact the Sickle Cell Disease Association of America at 1-800-421-8543 or visit their website at www.sicklecelldisease.org to find testing locations in your community. For more information about TOVA, visit us at www.tovacommunityhealth.org. TOVA Community Health, primary specialty care for the whole family. I am Dr. Nina, sickle cell expert, holistic medicine practitioner. You can also give us a call at 302-429-5870. or visit us at www.tovacommunityhealth.org, your neighborhood medical home.